Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Chief Medical Officer and Founder of Atlantic Coast Aesthetics, Dr. Thomas Pane. And Dr. Pane, this question comes from Twitter. We have a viewer that is not happy about their facelift, and they had a CO2 procedure. So you've seen the pictures. What recommendations can you give them, and how can you point them in the right direction?
Yeah, in this case, the person's only 3 months out. Now, we are lacking some important information. Most notably, what did the pictures look like before this first operation? Because the person does have some laxity of the neck. There are some bands there. They're not dramatic. And there's not really a lot of jowling going on. The skin, the way the pictures were taken, looks like the CO2 is pretty much recovered. I don't see much pinkness, so I don't know how heavy that CO2 was, or maybe that was something other than CO2. It could have been fractional. What I would say is, without knowing what they looked like before, 3 months is a little early to consider doing anything else. And the options would be non-invasive type things, like there could be additional laser done to the face. There could be radio frequency skin tightening done for the neck. Some injectables could be done for the neck bands. These probably aren't, very desirable, because if the person did the face and neck lift, and I don't know a neck lift was done, because we're not sure about that, I think they would expect a little more improvement, I'm guessing. So I don't know what the preoperative photos look like. But here I would say that if they didn't see what they really wanted to see, once enough time has gone by, they may benefit from a secondary facelift, paying particular attention to the neck to get those bands as improved as they can be. Then down the line, perhaps a comprehensive lasering of the face. That could either be Fraxel, which has to be done monthly over a longer period of time, or a CO2 procedure, which is a little more upfront recovery, but it is essentially the gold standard for a reason, because it is superior to all the other modalities and only one treatment. But the person has to be able to accept the recovery that goes along with the CO2. And I would tend not to do them at the same time, especially if they want a comprehensive treatment of the face. Usually we would do the facelift first and then do the other after. And again, this is not the only way to handle it. It really would depend on an in-person consultation, figuring out exactly what their expectations are and which areas they want to see improved, because you can customize this plan based on what they have going on and what they want to do in the future. So I think the good news, though, is that I think that they could be improved, and in one way or the other, they would see some benefit here.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Twitter, Instagram, or Facebook. And Dr. Pane, we'll see you on the next question.
Great.